Hi everyone, Nathan here from Personal Best Physiotherapy in Wodonga. I just wanted to shoot a quick video for you about knee pain, which I thought would be helpful for you. And we're talking about a particular knee problem called patellofemoral pain. So we're talking about, I've just put up here patella, the patella is the kneecap. And so in this video, I'm just going to tell you about what patellofemoral pain is, how do you know if you have it, and the important aspects of treatment. So we'll start with the first thing. So what is it? Patellofemoral pain is pain that arises from the kneecap or the supporting tissues around the kneecap. And it is the most common problem that we see in our physio practice. Sorry, the most common knee problem that we see in our physio practice. As you might imagine, we see a range of knee problems, but this one is by far the most common, and it affects patients of all ages. So it's really important that we're able to identify it and also help people who have this problem. So the reason that patellofemoral pain comes about, there can be a couple of different reasons, but most commonly it's either when the kneecap is not moving correctly, or when there is too much pressure on the kneecap because other things aren't moving or working correctly, or in some cases there might be some early arthritis on the underside of the kneecap. So there are three reasons why patellofemoral pain tends to come about. As I said, we see it in patients of all ages, from 13-year-old girls playing netball all the way through to 84-year-old people who have trouble out walking their dog. So that's what patellofemoral pain is. How do you know if you have it? Well, let's start with where the pain is. So people that have patellofemoral pain will say that they have pain in the front of the knee somewhere, so somewhere around or close to the kneecap, but often they can't say exactly where it is. In some other knee problems, the patient can sometimes with one finger say exactly where their issue is. But if you have patellofemoral pain, chances are you'll say that, well, there's something going on in the front of my knee, but I can't exactly put my finger on it. If that's you, then there's a good chance that you have patellofemoral pain. That's in terms of where the pain is. Then we move on to activities. So which activities or which movements reproduce your pain? And it's really important as a patient that you get clear on this if you actually want to fix it or get some help. So people with patellofemoral pain will say that their pain occurs when they do a couple of key activities. One of them is squatting or bending down. So this might be bending down to pick up your kids or your grandkids, so that sort of action. Or if you're bending down outside in the garden, so those activities that involve you bending the hips and knees to get lower to the ground. A second key problem that people with patellofemoral pain will say they have is that those activities that involve inclines, hills or stairs. So once we start going up and down, there is more pressure on the kneecap, and so it has to do more work. And if the knee isn't up to that, then the patient will say that they have pain. And then a third activity, which is often a problem but not always, is when the patient has trouble leaving their leg in a bent position for a period of time. And this would typically be, say, in the car for maybe longer than half an hour or longer than an hour. So the location of your pain and the activities or movements which reproduce your pain are really important to know. When you come into the clinic, then we do some special tests, and again those special tests should really reproduce your pain. And if we have those three things down pat, so pain location, activities and special tests, then we can be confident that we know what's going on for you. So that's number 2, how do I know if I have it? And then we move on to number 3, which is, well, if I do have it, what do I do about it? And if we think about treatment, then there's really 3 main things that we do in our practice to help these patients get better. The first one is exercise. And when we're using exercise to treat knee pain, then there's really a couple of different things that we're doing there. The first one is that we often want to increase the capacity or the strength of the leg muscles to do their normal job. So if for some reason those muscles have become a little bit weak or a little bit lazy, then we are using exercise as a means of getting them fit and strong and back to their normal job. But in some other cases, the problem is not so much strength, but that the person doesn't have a very good movement pattern. And when we look at them doing something like walking or going up and down a step or bending down, that their leg doesn't really move in the right way. And so in that case, the exercises are really about alignment. We want to try and get things working in a better position, much like you would sort of take your car to get a wheel alignment. Every so often, if the wheel alignment is off, then the car is not going to run nearly as well. So that's that part of it. And then the third major way which we use exercise is really about gradually increasing your function over time. So when you come in to see us, we need to work out what you can do currently, what you'd really like to be able to do, and then fill that gap. And we do that gradually over a number of weeks, seeing if we can get you from where you're at to where you want to be. So that's the main aspect of exercise. The other 2 important things to consider in treatment for patellofemoral pain is the foot, because the foot has a very strong impact on what's happening at the knee. So we always look at the foot. And then the third thing is that we're often using taping as a way of supporting the kneecap while it's sore to help you get going. So I hope that's helpful. Just a quick video on patellofemoral pain. So we've been over what it is, how do you know if you have it, and some important aspects of treatment. I hope you find that helpful. If you know someone who has this problem, then please share the video with them, and I'll talk to you soon.